okay? In this journal, they had the damaging effects of forward head posture. There's a deterioration of your health status with progressive forward head. Even minor forward head is detrimental. But check this. A 3/4 inch forward head has 144% higher mortality. People die 144% faster if they have a 3/4 inch forward head. You know what 3/4 of an inch is? Look at the board right next to you underneath your knees. That's 3/4 of an inch. If your head's forward 3/4 of an inch, you got 144% mortality. Don't believe me. Believe the research that they did. Believe what's out there. Because I didn't do the research. I'm just a reporter. But I see this stuff clinically all the time. This girl had forward head posture. This first bone should be at 90 degrees like this. She had forward head. It was compressing this area. This is where the hormones give the body nerve supply. This is the center for the immune system. This is the center that when you have compression on this, you can affect your vision, your hearing, your mood. We see kids with ADD, ADHD, dyslexic patterns, bipolar. That's where it's coming from because it's neurological. It's screwed up. She goes, I suffered with severe endometriosis and dysmenorrhea for years. I tried every medical treatment. As a last resort, they recommended a hysterectomy. A chiropractic exam, I discovered I had severe forward head posture and had lost the normal curve of my neck. I was astonished to see research on how the hormones are affected by the adjustments of my neck, page 261. My neck's not normal. My endometriosis has improved greatly. I got married. Now I can look forward to starting a family. She was just here. Did you see her with the 2 kids? This is the girl, right there. This is the girl. She was just here. She has 2 babies. There she is. She came in here. They were about to rip her uterus and ovary out. If you saw her, she was just here. She just walked out with the 2 kids and her grandma, which doesn't look like a grandma. I've known Vicki for years. She was the one who took the photographs of our wedding over 20 years ago. I've known her for years. This is her daughter-in-law. They were going to do a hysterectomy. They sent her over. She was living in Fort Collins at the time. She was getting ready to get married to Vicky's son. I said, that's your problem. It's in your neck. There's the hormones. Here's the research. Page 261. Go look at it. Next thing you know, all of a sudden she's pregnant. Just like the girl that I was telling you about, the physics lady who just delivered a baby 2 weeks ago. Jessica. You'll see her come in here. She just wrote us another testimonial. What you got to understand is we're not doing anything. We're not waving magic wands on people. Understand the principle, like the dog. You block the nerve, you will not function properly. Okay? She could have been holding that uterus and ovary in a pathology jar. Instead, she's holding her babies. That's a big deal. Here's one on hypertension. University of Chicago in 2007. They found that blood pressure can be affected by the adjustments up in the neck. Okay? And these people that, if you go on my website at Good Morning America, we have a video section. They see the doctors talking about how they go, wow, we just see these studies from England, and they found that the blood pressure can be affected by the adjustment of the neck. The 2 most common blood pressure medications, this adjustment to the neck does better than the 2 medications. We have to look into this. Chiropractors have been telling that to people for over 200 years. You know why? This is the control center for blood pressure. This is not a back pain treatment. There's the studies from England. They're right there on the wall. You can, all these studies all over the place, I know about this stuff. I don't put this up here to fill up my space. It's for you to read, so you can see this. When your neck is in the wrong position like that, and most of you people that come in, it will cause all sorts of problems with degenerative changes. It'll cause, this is called the kyphotic neck, where it's going backwards, okay? So it has poor outcomes in whiplash patients. It's very common with whiplash patients, when they have this neck, they have cerebral symptoms. Right now, I'm putting together a program for the schools, and we're going to be donating these little cards. I'm going to probably, if we have enough room, we're going to put a magnet on the back so they can stick it on their refrigerator. And it has to do with concussions and neck trauma. Most people don't know this, but when you get a concussion, the subsequent symptoms you get after that are not from the brain, it's from the neck. Because if it was enough damage to hurt the brain, it's enough damage to screw up the neck. And so what happens, like they see here, is that you get what's called cerebral symptoms, headaches, trouble concentrating, moody, can't sleep, all these different types of things. So this type of a neck is 18 times more likely to have complaints, okay? Headaches. When you got this neck in this position, this bone is jammed up over here, 6,000 cases of chronic headache sufferers found that when you have a complete or segmental loss, a reversal of this curve, the cervical spine is the most consistent characteristic found with people who have headaches, including migraines. This is what I was telling you about. When your neck is going that way, just take your hand and bend it backward. That's what this neck, that's what the spinal cord is going through when you do this. Feel how that feels and tell me if you'd like to live your life like that. Well, guess what? You are, if your neck is like that. Well, one of the things they found here is that this damages the spinal cord. As the kyphosis progressed, an increase in degree of flattening of the spinal cord and histological change, including loss of this all neurological stuff, you won't understand that. But basically what they said is this influences systemic health and is related to demyelinating diseases such as MS. Because of the neck, the spinal cord is breaking down. This guy's a neurologist from Canada. In Syracuse University in 1995, they said chiropractors were right all along. Scientific and anatomical proof proved that the majority of headaches come from subluxation that are occurring in the base of the skull. This is why. When your neck is curving and has a wrinkle in the spinal cord, that's good. When the neck is going the other direction, it's got tension in the spinal cord. This neck should curve like a C, okay, just like this red line. But when it's going forward, the spinal cord gets too tense. The discs get damaged, they get worn out, the body builds spurs, and the next thing you end up with is arthritis. That's why people get all these types of symptoms, hormonal, immune, lowered resistance, all this kind of stuff. In fact, resistance, studies have found that the nervous system is what controls your immune system. When you get a cold, they have studies from Germany, and you'll see some posters down the hall over here on kids. You get an adjustment within 24 hours, 92% of the population, when you get an adjustment, if you have a sore throat, the sore throat goes away, 92%. And the reason is because the immune system is what is controlled by the nervous system. Nerve dysfunction is stressful to the organ. This is visceral nerve. That's what the organs nerve. And other body structures. And lower tissue resistance modifies the immune response. Here's a study on pharyngitis and laryngitis. 57% of patients with pharyngitis were treated with the first day with a sore throat with a manipulation in the neck and a saltwater gargle. They were all symptom-free second day. 100% of patients with laryngitis were treated in the first day of the illness with an adjustment or spinal manipulation, and the voice returned within 1 day. How many times do you see people with laryngitis or whatever, they go to the doctor, give them all sorts of sprays and everything else? But 100%? There's a study done in Denmark. They found out with kids with colic, 97%, one adjustment, the kid stops crying. You've seen it if you've been in the clinic. Patients come in. I had one little baby, 3 months old, constant crying while it was awake. Always screaming, always crying. They did everything for this kid. I said, bring him over here. They put him on the table. I gave the kid an adjustment. Within 2 minutes, the kid was asleep. One adjustment. It was gone. We put our kid